Hi guys, how you doing? This is Lucia. It's been a while since I was here last time. I think the last time I made a video was uh, around November 2013, I think. Um, so for the ones of you who know me, you kind of probably know why I was absent from YouTube, and for the ones who don't know who I am, I'm gonna try to give a little recap of what happened. So I had a lap band surgery in December 21st, 2011, and so I spent almost the whole year of 2012 um, working on my weight, right? So making videos, that was one of the things that helped me so much, making the videos. And I was running. I did the Couch to 5K program, and I was doing like 5Ks, running 5Ks at least once or twice a month. I did one marathon, half marathons. Sorry, I did one half marathon that I completed, and the second half marathon that I was not able to complete because it was like a really, really hot day, and I collapsed on mile 10. It was just like, anyway. So, and then I started my graduate program. I went to university for a PhD, to pursue a PhD in clinical psychology. At that time, I met someone who we are still together and extremely happy, which is, really good. And somebody who we kind of think we know who it is, started sending ham emails. This person opened a fake profile on the internet and pretended that they were me. It was just like a weird thing. And then they sent a letter to my university claiming that I was not being ethical, that I was disclosing information from patients on YouTube, which was not true at all. So much so that the director was so annoying that this happened. But the director looked into my videos. My academic advisor looked into my videos. One of my professors looked into my videos. They looked at a lot of things. I had I don't know how many videos uploaded. They found nothing unethical on my YouTube page. But at the time, I was feeling so upset with the whole thing that I decided, you know what, I'm going to not do my videos anymore. This is ridiculous. I'm upset about it. And I also thought, it's I just wanted some privacy from my personal life compared with my patients. So I did not want to mix that together. So since 2013, I've been working like crazy on my PhD. I earned my master's degree 2014 in psychology. Right here. Is it? Yeah, that's it. I'm continuing to work. I've been, I worked in different settings already as a therapist, and anyway, so I was trying really to not have any personal information that could be, accessed by a patient. But I was talking to my academic advisor last week, and I told him, like, well, he said, do you miss it? I said, yes, I do. I mean, I made some good friends online, and I have, as I mentioned several times, this passion about working with obese patients to kind of help them. And I'm on the process of preparing my proposal for my dissertation, and he gave me the okay to talk about it, like and maybe start talking to people about my dissertation. So which is awesome. So I thought, you know what, so maybe it is okay for me to go back and make some videos, especially because I am in the process of having a conversion surgery from lap band to probably a sleeve surgery, and I will tell you why. So, as I mentioned, I had the lap band in December 21st, 2011, and I was 260 pounds at the time, so I was able to drop from 260 down to all the way down by November 2012. I was 173 or something. I didn't do the math, but it's like it's close to 90 pounds, I would think. So I was really happy, but in August of 2012, that's when I started my PhD program, and I felt like my life was kind of over. My formal life was kind of over because I could not find time to do anything. I couldn't exercise. Any free time I had was spent studying, writing papers, reading books and articles, seeing patients. So it was craziness. And I started, for a while I was able, I kind of gained 20 pounds, and it was just like, okay, I was still in Wonderland for a while. 2013, I was still in Wonderland. By 2014, I started, my weight started creeping up. And then I crossed over the 200 pounds. So right now, I'm not sure, but I'm around the 220s. I'm not sure exactly how much because I didn't weigh myself like in the last few days. So that was like upsetting me that I gained the weight. So, but there was some things that happened that made me really, really consider the fact that I needed to do something about it, because I've experienced on and off a very strange pain right in the middle, around where the lap band's supposed to be. So I experience this kind of pain sometimes that it's really overwhelming. Like I feel like pain in my heart sometimes, and it also kind of affects my jaws and my teeth. It's kind of have this pain that radiates from the heart, and from studying. I mean, I did 1 year of clinical medicine for school, and I know that there's a connection between this type of pain around the jaw and the mouth within the heart. And I'm just like, is that like the band is slipping, or is that any sort of, I don't know. I don't know what it is. But I got concerned about it. And then I know that some people in the community had a slip with the lap band, and they had to had the lap band removed. So I did not want that to happen to me. And both my parents, they are diabetic. They were my father passed away last year. It was very, very sad moment for me. But and then I thought, you know what? I need to make sure that I don't develop diabetes type 2. That's what they had. And diabetes type 2 is directly related to weight. So I decided to talk to my surgeon. I can't remember when I saw him, maybe August or September sometime, and he gave me a price, because at this point I have Medi-Cal, and my Medi-Cal will not cover him. So I decided, that I'm going to go back, and I'm going to have an appointment with him now, November 12th, and I'm going to set up a date for a surgery in January for this surgery. So he told me that the best results would be if I could have actually 2 surgeries. One to remove the lap band, and then 3 months later to have the sleeve done. That's what he wants to do. I went there with the idea of the gastric bypass, and he's telling me that maybe the sleeve is the better option. It's safer in the long term, and so I'm going to talk to him again about it. And so then that's the reason why I thought, I think I should go back and do my videos again and see what happened. I don't know. I just hope that I'm able to continue making my videos. I don't know, but I will try. So I am not going to start any diet, any process of dieting until I see him, because I know that he's going to ask me on the 12th to lose at least 10 pounds. That's what he said the last time. Although my weight was much, much higher than it is now. But I'll see what he has to say. And of course, next week on Tuesday, it's my birthday. So I don't want to start a diet before my birthday. And so anyway, I just wanted to tell you guys that I decided to come back and not be bullied for this person who was trying to stalk me, and because I know I didn't do anything wrong. I just really annoyed by it, and I was so busy that it wasn't worth it, trying to do anything about it. But since my advisor said it's okay for you to do it, because he knows that I have a really big relationship with this community. I even was so honored and so happy that Antonia asked me this year to perform at the Weight Loss Surgery Foundation of America event here in San Diego. So I was really honored that I went there and I performed for some of you guys, and I was able to sing, I think, 2 songs, and I did it with all my heart. And so I'm very involved with this community. I'm very involved with my passion for trying to do something to help obesity. Anyway, so guys, I just want to tell you guys that I'm here, and hopefully I'll be back, and I will keep you guys posted of what's happening with me in my life and in my school, and that's it. All right, so bye guys. Thank you so much for having been so nice, and I read the messages you guys left in my last video, and I was really touched. So thank you, and I hope to see you guys soon. Bye.